So yesterday, when I went to get my blood drawn, I'm not scared of needles anymore. I used to be when I was little. I was terrified of them when I was little. I used to hyperventilate when they used to take my blood when I was little. But I'm not scared of needles anymore because I was a phlebotomist. And before I was a phlebotomist, I was a vet tech. So we used to have to take blood from animals, which veins are much, much smaller than ours. So when I went to medical assisting school, I just did the whole course, the whole 9-month course. The phlebotomy course was only 3 months. But I went ahead and did the whole course because I thought, well, if I don't like one of these things, I can switch to another one and I'll already be trained. Because we learned billing and we learned like how to be a medical assistant and we learned phlebotomy and we learned everything. So I leaned towards phlebotomy because I was good at it, because I was a vet tech. But yesterday, I was in the phlebotomy chair, and they had called this girl back before me. And, you know, she looked like she was in her 20s, and I'm 60. And she was sitting there freaking out because she didn't like needles. She's only 20. We got around to the fact that she was 20. And I was sitting there as the guy who usually draws my blood was sitting there. He wasn't even trying to comfort her. Wasn't even trying. So I was in the other chair facing her while the lady was taking my blood, trying to calm her down. And I said, "You're going to be okay. You're not even going to feel it." And I said, "At least you have a butterfly." She goes, "Well, what's a butterfly? What's that?" Calm down. A butterfly is the smallest needle. It's just called a butterfly because of the little thingies on it that we hold to guide it in. And it's one of the smallest needles I have. So you're okay. You're not going to feel it. And I said, when I was a phlebotomist, and I told the lady before she even started sticking me that I was a phlebotomist. And I knew what she was doing because I asked her what the doctor wanted. And I said, "I know she wants a full panel." She goes, "Yeah." And I said, "I was a phlebotomist, so I know what you're talking about." And I know I told her to get the vitamin D. And she's like, "Yeah, she ordered a vitamin D." I said, "Okay, good." So after that, I was trying to calm this lady down. And I tried to distract her, you know, asking her what she did for a living. And she's in the insurance business. And she says, "All I have to do is do this for 10 years and I can retire." And she goes, "At 29, I can retire." And I said, "What are you, only 19? She goes, "No, I'm 20 now." She goes, I've been doing this for a year." And I said, "Oh, okay." I said, "Well, that's awesome." And so I'm trying to distract her. And then I told her she was getting a butterfly, not one of them big old huge needles. And like I said, the guy wasn't even trying to calm her down. And I said something about when I worked at LabQuest, I had to get a guy in one of our chairs, you know, lay him out because he had passed out in my phlebotomy chair. And he's like, "We get that every day in here." I'm like, "What?" I said, "That only happened to me once when I worked at LabQuest." I said, "It never happened at the hospital. Not even anybody ever got queasy at the hospital." And I was an on-floor phlebotomist, so they're already in their bed. But they never even told me they were getting lightheaded or anything because they never felt my needle. And I even said that to the lady. I said, when I was a phlebotomist, they never even felt my needle because I always used a butterfly. And then the lady in the lab, she's like, "Well, when we get them," she goes, "they don't always give them to us because they don't always order them because we can't always afford them." So I don't understand a phlebotomist that sits there and lets somebody freak out and not try to calm them down. Because I actually had to calm down a little girl in the outpatient one day because the normal outpatient phlebotomist couldn't calm her down. And I happened to be in the lab, which was the door right behind the outpatient room. And the lady leaned in the door and said, "Is Melody in here?" And I said, "Yeah, I'm right here." She goes, "Can you please come out here?" So, because I guess I had a reputation in the hospital for being a really gentle phlebotomist and caring. Because when I went up to the floors, the nurses always told me that their patients always said that about me. Which was nice, which was very nice to be heard, which was nice to be heard. by the nurses, and that their patients had told them. So I went out to this room, the outpatient room, and the little girl was like 8 years old, no more than 9. And she was terrified. And she's like, I'm so scared of that needle. I said, sweetheart. And I bent down to her eye level. She was in the chair, and I'm so tall, so I had to squat down in front of her. And I said, sweetheart, there's nothing to worry about. You're not even going to feel it. I promise. Because I was the one doing the draw. She wouldn't let the person in the outpatient room do the draw because she was scared of her. Why? I don't know. Maybe she had heard her before. I don't know. But I told her, I said, I'm going to draw your blood. And I was real gentle, and my voice was really low, and I was really calm. And I calmed her down, and I got her to relax. And then I put the tourniquet on her arm and let it sit there for about 15, 20 seconds so the blood could back up so I could see her vein. I used a little butterfly needle, which was really small, and I stuck it in her arm and started drawing the blood. And she looked at me and she goes, was that it? I said, yeah, that's it. So I probably cured her of her fear of needles until she gets another phlebotomist that's not a good phlebotomist. I don't understand a phlebotomist that sits there and lets their patient be consistently upset without trying to calm them down. So I sat there across from this 20-year-old and calmed her down. I actually calmed her down. And then when he stuck the needle in, I said, you're not even going to feel it. You're not even going to feel it. And he said, poke. And she went, mm. I said, that's it. It's over. That's all there was. And she relaxed after that. And then when the lady did mine, she stuck mine in, and I'm like, she goes, poke. I'm like, I don't even feel that shit. You're killing me. But anyway, whenever I'm in a phlebotomy office and there's somebody freaking out, I always try to help the staff calm them down. Because I don't like seeing people like that. When that guy passed out of my chair at LabQuest, I kind of freaked out because I'd never had anybody pass out in my chair before from a needle stick. Because then again, the needles they made us use at LabQuest were the really big ones. We never got the butterflies, which were really small. But anyway, I'm really glad, I just want to say, I'm really glad I helped her. I helped calm her down. And she didn't hyperventilate or pass out or anything. So, those of you that don't like needles, and if you've got small veins that they can't find, ask them to use a vein finder, for one. If they can't find a vein finder. Because it does help with people with really small veins. And, there was another point. 2, if your patient is uneasy, please speak to them softly. Please try to calm them down easily. And tell them there's no big deal. It's just a little tiny little needle. And they're not even going to feel it. So, that's my phlebotomy rant. I just wanted to tell y'all that because there's no reason for somebody to sit in a phlebotomy chair and be terrified. There's just no reason for it.